RV is triangular. And when you come to the transgastric view, you find that the RV becomes crescentric. So these are the normal shapes of the RV. So that's a crescentric RV. The RV is divided into three parts. The inflow, which is involving the tricuspid valve with the chordae and the papillary muscle, the trabeculated apical myocardium, and the smooth outflow myocardium or the infundibulum. This is from Gour and Lilly. How do we identify the RV? To say that this is the RV and this is the LV, there are two things. One, more than two papillary muscles are usually present in the RV. And you always have the moderator band in the RV most of the times. The moderator band is a band which arises from the anterior papillary muscle and crosses across to the intraventricular septum. So whenever you have the moderator band, it is the right ventricle. Now there is a short axis of the RV. Again, that's the moderator band from the anterior papillary muscle going onto the septum. The second identifying feature is how does the septal leaflet of the tricuspid valve take off? Usually, the septal leaflet of the tricuspid valve is apically displaced. This is the anterior mitral leaflet there, and this is the septal tricuspid leaflet. So that's the difference. So whenever you see this apical displacement of the valve on the right-hand side, this is the RV. So whenever you have the moderator band, and whenever you have the septal tricuspid leaflets taking off apically, it is the RV. So that's the anterior mitral leaflet here, and that's a septal tricuspid leaflet. This is a true four-chamber view. So that's how you identify the RV on echocardiography. What are the walls of the RV? The medial wall, which is the interventricular septum, the lateral free wall. The lateral free wall gives most of the RV contraction. And that's the most important wall of the RV. The other wall is your RV diaphragmatic wall. This is in the RV inflow-outflow view. And this will tell you how the RV diaphragmatic wall is moving. The other two walls are the inferior wall. There is a transgastric two-chamber view. That's the inferior wall near the liver, and that's the anterior wall. So these are the walls of the RV. So what's the blood supply of the RV? 80% of the RV is always a right dominant circulation.